Hello guys, so today's topic is immunodeficiency disorders. So there are three types of immunodeficiency disorder. First is B cell disorder, T cell disorder, and third is both, means B and T cell combined disorders. So first of all, we come to B cell disorders. So there are three types of B cell disorder. First is X-linked Brutons, A gamma globulinemia. Second is selective IgA deficiency, and third is common variable immunodeficiency. Brutons is important, selective IgA is important, common variable immunodeficiency is not important. So, first of all, X-links Bruton's A gamma globulinemia. Since we know that it is a B cell disorder, means that only B cells will be affected and immunoglobulins will not be present. So, it is a defect in BTK. You have to remember it. A tyrosine kinase gene. Another question which has been asked. No B cell maturation. There will be zero B cell maturation. It is an X-linked recessive disorder. Very important, X-linked recessive, and hence it will be common in boys. The whole of this thing is asked in questions and it is important. Every line is important in this particular topic. What is the presentation? Recurrent bacterial infection, enteroviral infection after 6 months. So this thing is important after 6 months. Okay. Why after 6 months? Because till 6 months of age, maternal immunoglobulin G, maternal IgG will be present inside the baby's body. So the baby will be protected from the disease till 6 months of age. And when the maternal IgG decrease after 6 months of age, then the bacterial infections and enteroviral infections will come to play. What are the findings? Absent B cells in peripheral blood, decreased immunoglobulin of all class, absent or scanty lymph node and tonsil. Very important. Primary follicles and germinal centers are the places where B cell reside, so they will be absent. Live vaccines are of course contraindicated because it is an immunodeficiency disorder. Okay, we are done with it. This particular topic is all about learning and remembering and memorizing things. Nothing much to explain. So, and every line is a question. Second, selective IgA deficiency. So it is the most common primary immunodeficiency disorder. It is a very important question. Most common primary immunodeficiency disorder, and every presentation of it starts with A. Majority is asymptomatic, causes airway and GI infections. Autoimmunity disease, it is an autoimmune disease. It will cause autoimmune disease that can cause atopy and anaphylaxis to IgA containing blood products. Extremely important point that it causes anaphylaxis to IgA containing blood products. Anaphylaxis to IgA containing blood products. The findings are decreased IgA with normal IgG, IgM levels. All other immunoglobulin levels will be normal except IgA, which will be decreased. Susceptibility to giardiasis, very important question, giardiasis, and false negative celiac disease test, very, very important. It has not yet been asked, but if it is asked, it is going to be a very important and very easy, but very less people are going to answer it. Okay. Now coming to common variable disorder, I already told you it is not important. And the main thing about it presents in childhood and it causes autoimmune disease, decreased plasma cells and decreased immunoglobulins. So we are done with B cell disorders. Now coming to T cell disorders. In T cell disorders, first is thymic aplasia, second is interleukin 12 receptor deficiency, and third is autosomal dominant Job syndrome or hyper IgE syndrome, and fourth is chronic mucocutaneous candidiasis. What is important? Thymic aplasia, important. Interleukin 12 receptor deficiency is important, and Job syndrome is important. Fourth one, chronic mucocutaneous candidiasis, is not important. So, thymic aplasia. Thymic aplasia is nothing but Dijot syndrome. Okay, 22q11 microdeletion. Very important question has been asked from it. Failure to develop third and fourth pharyngeal pouch. Again, a very important point. Third and fourth pharyngeal pouch. People make mistake over here. They answer arc and other things. The answer is third and fourth pharyngeal pouch. Okay, absent thymus and parathyroid glands. So, the main reason is Dijot syndrome, and another reason is velocardiofacial syndrome. In velocardiofacial syndrome, palate, facial, and cardiac defect is present. It can also cause thymic aplasia. So what is catch-22? The presentation is catch-22. You can remember it by the mnemonic catch-22. C for cardiac defect, conotruncal abnormalities are present. A for abnormal facies, T for thymic hypoplasias, C for cleft palate, and H for hypocalcemia. Why hypocalcemia? Because the parathyroid gland will also be absent. Parathyroid gland will also be absent because parathyroid gland is also formed from the third and the fourth pharyngeal pouch. The third pharyngeal pouch forms the inferior parathyroid gland and the fourth pharyngeal pouch forms the superior parathyroid gland. It is inverse. You must have studied it in embryology. Now coming to the next part, decreased T cells. It will cause T cell decrease because we already know that it is a T cell disorder. Decrease in parathyroid hormone because parathyroid hypoplasia is there, and decreased calcium because parathyroid is decreased, and thymic shadow will be absent on chest X-ray. In chest X-ray, thymic shadow will not be seen. Now coming to the second T cell disorder, interleukin 12 receptor deficiency. If interleukin 12 receptor deficiency, see, interleukin 12 is responsible for T helper 1 maturation. Okay, interleukin 12 is important for T helper 1 maturation. If interleukin 12 is not present, then of course T helper 1 will decrease. It is an autosomal recessive condition, very important. It is an autosomal recessive condition. Next, Disseminated mycobacterial and fungal infections will be the cause, because the interleukin 12 and T helper 1 cell maturation, we all know from the immunology basic classes that this particular process is very important for formation of granuloma. Since granuloma will not be formed, granuloma will be absent, hence my disseminated mycobacterial and fungal infections will ensue, may present with administration. After administration of BCG vaccination, these particular things can happen. So what are the tests? Decrease in interferon gamma. We also know that in granuloma, the main interleukin, the main cytokine or the factors are interferon gamma. Okay, so interferon gamma is decreased. That's it. Now coming to the third part, autosomal dominant hyper IgE syndrome or Job syndrome. Okay, so in Job syndrome, the most important question is, it is an autosomal dominant condition. We already know from the name itself. And another important part is hyper IgE, means IgE will be raised. If in a question you are given it is an autosomal dominant condition or IgE increased, your first thing should be, the first thing that should be in your mind is autosomal dominant hyper IgE syndrome or Job syndrome. What are the clinical features present in it? The clinical features can be remembered by abscess. And what type of abscess it is? It is a very important thing. Cold abscess means not non-inflamed abscess, which means fever will be absent. Okay. The second thing is baby teeth or retained teeth. Okay, retained baby teeth. The teeth will be retained. Next is coarse facies. The facial features will be coarse, and there will be many dermatological problems, and increase in IgE we already know from the name, and fractures from minor trauma can also ensue. Okay, in findings we will see increase in IgE because it is hyper IgE, and since IgE is increased, so increase in eosinophils. Okay, so that's it. What is the main cause of this particular Job syndrome? Deficiency of T helper 1. Deficiency of T helper 1. Deficiency of T helper 1 is the main thing, and STAT3 mutation. These things are asked in INICET. Okay. Now coming to the last part, chronic mucocutaneous candidiasis. This particular part is not important. It causes candidiasis in skin and mucous membranes. The name suggests it's only. Okay. Now coming to the last part, immunodeficiency part continued. Both B and T cell disorders. So the first thing over here is severe combined immunodeficiency. It is a very important thing. Second, ataxia telangiectasia, very important. Hyper IgM syndrome, extremely important. It came in INICET exam which I gave. Then last is Viscott-Aldrich syndrome, again an important thing. So nothing is not important in B and T cell disorder combined. So first of all, severe combined immunodeficiency is a topic which we have already studied since class 12. Okay, so what is this actually? Several types including defective interleukin 2 receptors are present. Interleukin 2 receptor gamma receptor chain is present. This is an X-linked recessive disorder, or it can also be an autosomal recessive disorder if the adenosine deaminase deficiency is the cause. So there are two causes of SCID. The causes of SCID are two. First is interleukin 2 receptor gamma chain defect or adenosine deaminase deficiency. If the adenosine deaminase deficiency is the cause, it is an autosomal recessive condition. If interleukin 2 receptor gamma chain defect is the cause of SCID, then it is an X-linked recessive condition. Important point. What will be the presentation? Various types of infection will be there and failure to thrive. And what will be the finding? Decrease in TREX. What is TREC? T cell receptor excision circle is a marker that there is a complete immunodeficiency in the body. Okay. Absent thymic shadow will also be present. Germinal center lymph node biopsy will be absent. T cell flow cytometry will, everything will be absent. Now coming to ataxia telangiectasia, a very important thing, ataxia telangiectasia. And ataxia telangiectasia, first of all, there are 3 A's. Okay, the name itself suggests that the disease consists of ataxia and telangiectasias. So ataxia means cerebellar defects first, then spider angiomas or telangiectasia second, and IgA deficiency third. Very important. Ataxia telangiectasia consists of 3 A's. A for ataxia, another A for telangiectasias or angiomas, and another A for IgA deficiency. Okay, very important. Generally question comes from here only and nothing else is asked. Another important point about it is an autosomal recessive condition. It is an autosomal recessive condition and the defect lies in ATM gene or failed ATM gene. Okay. Now the findings will be increase in alpha fetoprotein, another A. It is an easy way to remember, and decrease in 3 immunoglobulins. IgA, IgE, IgG. Okay, decrease in age. It is an important point. You have to remember questions are generally asked or may be asked in various examinations in the form of true or false. Like which of the following statements are false, which of the following statements are true. These questions are asked in these format only. Okay, and there is very important point written over here. Risk of lymphoma and leukemia is increased. Very important point. Now coming to third thing, hyper IgM syndrome. See, the main defect in this particular problem is CD40 ligand defect. Okay, and CD40 ligand actually binds to CD40 on the T helper cells, which is important for class switching, and this particular class switching cannot occur. Okay, and if class switching cannot occur, if you have read the chapter of class switching, you will come to know that initially in every infection the B cell or the plasma cell release IgM. After the primary response, the secondary response comes after class switching, and the cells release IgG, IgA, and IgE variety type of immunoglobulins. So if there will be no class switching due to lack of CD40 ligand, then only IgM will be present, and IgA, IgE, and IgE will be absent. And also there will be failure to make germinal centers. Okay, so what is the presentation? Presentation is pneumocystic pneumonia, cryptosporidium, and CMV infection, means opportunistic infections. Important part is CD40 ligand and class switching. Now, Wiskott-Aldrich syndrome, the last part. In Wiskott-Aldrich syndrome, mutation in the VAS gene is present. Okay, a VAS gene is present. Leukocyte and platelets unable to recognize actin cytoskeleton, and it is a defective antigen presentation. It is an X-linked recessive disorder. Important point to remember. Also, hyper IgM syndrome is also an X-linked recessive disorder. About SCID, I have already told you, it can be X-linked recessive or autosomal recessive based on what the particular defect is. Okay, in Wiskott-Aldrich syndrome, you can remember the presentation with water, WATER. Wiskott-Aldrich, thrombocytopenia, eczema, and recurrent pyogenic infections. Okay, and fewer and smaller platelets are found, decrease to normal IgG, IgM, and decrease in IgA and IgE. Okay, so these particular things generally not asked. Only the presentation part or water part is the main thing that will be presented in your clinical presentation questions, and you will be asked that what type of defect it is or what defect it is, what is your diagnosis. That's it. Now coming to the last part, phagocytic dysfunction. Phagocytic dysfunction is also comes under immunodeficiency disorder. In phagocytic dysfunction, all these three are important. Okay. First of all, in leukocyte adhesion deficiency type 1, what is important? LFA1 integrin CD18 defect is present, due to which the phagocytes migration and chemotaxis is defected. Important point, autosomal recessive condition. Okay, since the phagocytes cannot come, so there will be no inflammation, and inflammation is required for separation of the umbilical cord. So late separation of umbilical cord more than 30 days is present. Also, the pus will be absent in our body, because pus is required. Pus is present only when the leukocytes and other cellular components of inflammation come, migrate, and reach the site of infection, and only then the pus will be formed. If migration chemotaxis is absent, how will the leukocytes come? And if leukocytes don't come, pus will also be absent. Also, dysfunctional neutrophils will be present. Okay, that's it. Also, one thing is important: impaired wound healing. Now coming to second part, Shiryak-Higashi syndrome. In Shiryak-Higashi syndrome, this particular image is important. It can be asked in one of the other examinations. Till date, it has not been asked. Okay. In Shiryak-Higashi syndrome, the main defect is LYST, LYST, lysosomal trafficking regulatory gene. Okay, phagosysosome and lysosome fusion, and it is also an autosomal recessive condition. The main problem in Shiryak-Higashi syndrome that we all know, that there is one phagosome which engulfs material which has to be lysed. Now this phagosome actually combines with another lysosome which contains lysosomal enzymes which will degrade those material present in phagosomes. These two, phagosome and lysosome has to fuse, and then only the degradation process will be completed. If this fusion is not functioning just because of LYST defect, then Shiryak-Higashi syndrome will occur. Okay, means phagolysosome fusion disorder. So what is the presentation? Progressive neurodegeneration. Why neurodegeneration? Because this particular process is important for nerve functioning. Second, lymphohistiocytosis and albinism, partial albinism will be present, and pyogenic infection and peripheral neuropathy will also ensue. Okay, why pyogenic infections? Because in phagolysosome is important for degrading the bacteria. Also peripheral neuropathy, because these neurotransmitters are present in phagolysosome, is present in the vesicles, and the LYST is again important for throwing these neurotransmitter out of the vesicles in the nerve endings into the synapse. That's why peripheral neuropathy will occur, pyogenic infections will occur. Albinism or partial albinism is also important because the melanosomes use the same mechanism. The melanosomes use the same mechanism for pigmentation. Okay, that's it. Also, what is important? Mild coagulation disorder will be present. Lastly, chronic granulomatous disease. It is due to NADPH oxidase deficiency, decreased reactive oxygen species of superoxide dismutase, and it is an X-linked recessive type of disorder. Increased susceptibility to catalase positive organisms will be there. And what is important? Dihydrorhodamine flow cytometry test is done, and it is an abnormal. When we'll understand that it is abnormal? When the decreased green fluorescence is present. And also nitroblue tetrazolium dye reaction test is also used. Also it is obsolete, fails to turn blue. These things are not that important. Only the enzyme part is important, and susceptibility to catalase positive organism is important. So that's it, guys. I have told you everything important about immunodeficiency disorder from the first aid, and this is everything that you need to know. Okay, so I have scrambled a lot of things over the pages from the first aid. So I will put the pages and mark only the highlighted points in it in a clean manner to you. So here I have clearly mentioned all the important points and highlighted all the important points about this whole topic in both the pages. This was done to make it clear and so that you can take a screenshot or write down the points which I've highlighted. If you want to leave the unhighlighted points, you can leave. There is no problem in it. Generally, questions are asked from the highlighted and underlined points only. So thank you. It was a very big topic, but questions are definite in INI or in PG or in next. So it is an important topic, and prepare it properly and memorize it more than 5 to 7 times before you go to your exams. Thank you.